Good morning. My name is Joe Doherty. I'm the Communications Director for the Utah Department of Public Safety and helping with the state's COVID-19 response. Today is the briefing for Thursday, October 1st, 2020. We have two speakers today. We'll start with Governor Herbert, and he'll be followed by Dr. Clark Bishop from Intermountain's Utah Valley Hospital. Governor Herbert.
Well, thank you, Joe. And thanks to everyone out there that's listening in, to the media that's present. We appreciate, as always, these weekly opportunities to bring you updates on where we're at with the COVID-19 pandemic and other relevant issues that are probably important to all of us, particularly under the emergency situation we find ourselves in today. To begin, I just want to mention, I just returned from a trip to Washington, D.C. We spent a couple of days there meeting with people involved in health. Had an opportunity to spend some time with Seema Verma from CMS and the Department of Health. Talked about what was taking place with her office and what her observations were on a nationwide basis. Also had a chance to talk with Admiral Brett Giroir, who's the Deputy Secretary of Health, and his office, and talked about what his observations were, where we've been and where we're at. The surges and the challenges that we see here in Utah taking place are certainly not unique to Utah. It's happening in a variety of different states, different locations. It's like everybody's taking their turn. And so we're not in a unique situation. It's still frustrating for all of us, I'm sure, as we see these spikes that are taking place. I know Governor Cuomo just said here just a few days ago that we shouldn't be too surprised. He said as he sees now rising case numbers in New York, because now kids are going back to school, or starting to gather more together and starting to have more indoor environmental contact. And so we see these spikes that are taking place. I'm encouraged by what I learned when it comes to the vaccine. I know that anything that's going to help us get back to more normal socialization is going to be when we can be inoculated against catching and spreading the coronavirus. It appears to me, based on what I learned over the last couple of days, that it's not a matter of if, it really is a matter of when. You can find a variety of dates, whether it's by the end of this year, by the first part of next year, the end of the first quarter. But it does appear with this all hands on deck effort that there really is going to be a vaccine which is going to help us sometime in the near future. Now, in the meantime, we still have challenges here at home. Our pandemic numbers still are higher than they've ever been. Our 7-day rolling average, which is approximately 1,000 cases, are still out there causing us concern. I think I want to emphasize, in fact, I know I want to emphasize today that we talk in terms of these media reports in terms of numbers. And I'm concerned that as we talk about numbers, it just kind of rolls off our tongue and maybe rolls off our ears. These are not just numbers and statistics. These are people. These are people who are being infected and having their lives disrupted. And whether it's impacting themselves individually, impacting their family, their friends, loved ones, their colleagues and coworkers, it's an issue that we need to make sure we remember the individual personalization that's necessary behind the numbers. And so, again, what we're doing is extremely important when it comes to the individual. Let me just kind of go to, I know a lot of you are probably interested. We had an audit. It's been in the newspapers about this audit. It was just completed by John Dougal, our state auditor, which we appreciate his work there. But in talking about a pandemic, I remember the good words of wisdom by former Governor Mike Leavitt, who met with our state leadership at the beginning of this effort here, the first part of March. And he said, and again, reminding everybody, he served as the former Secretary of Health and Human Services under the Bush administration. Here's what he told me. Everything we do before a pandemic will feel alarmist. Everything we do during a pandemic will feel inadequate. And that kind of sums up, the audit. We didn't do enough beforehand, and now we have people wondering if we're overreacting. And the truth is probably somewhere in the middle of all this stuff. I want everybody to know that since the date that we declared a state of emergency and as we watch this thing unfold, it really has been an all hands on deck effort by everybody, not only just in the executive branch, but by the legislature too, in trying to help us work together to find solutions to the challenges that we face. And not only that, but the private sector stepped up and said, we have a role to play too, and what can we do to help us slow down and stop the spread and shorten the pandemic. We said when we had some issues that came up midway through this effort, as we did our own internal audit to decide what was taking place and some questions on some contracts. Again, we're in a state of emergency and we have no bid contracts that are taking place. And we said that as we looked at what was taking place under these rapid fire conditions, that there was some failure of communication between agencies and individuals. So communication was a problem. You can understand the fog of war, as it were, at that time. But also that everybody was working in good faith and trying to find solutions in a very difficult and challenging and really unprecedented time and effort. By the way, in order to be transparent on all the contracts, we do have a web page for anybody who wants to look at all the contracts, the amounts of money spent, where they went, etc. You can go to our coronavirus.utah.gov and find a link, coronavirus.utah.gov and find a link there, or you can go directly to purchasing.utah.gov/COVID-19. That's purchasing.utah.gov/COVID-19. And that's been up for months. So the effort to be open and transparent has always been there. I appreciate the purpose of audits, to make sure that we're held accountable. It's also, audits are designed not to necessarily praise, but to find gaps, find where we can improve, and look for ways that we can, in fact, have a better response, certainly for the future opportunities that we'd have if we have a pandemic sometime in the future. We're certainly going to be better prepared. One of the criticisms in the audit was that we didn't anticipate enough of this pandemic. And pandemics are unique. It's not like an earthquake or fire, flood, which are localized events, which we have them every year. We have, a couple of hundred earthquakes, although they're small, every year. So when we have the great shakeout, we have the ability to isolate and locate, say, well, this will happen, and pick a geographical location. We might have some stores closed, disruption of traffic. It's like a fire drill we used to have in school. It's an easy thing to, in fact, prepare for. Pandemic, not so much. It permeates everything in our society, impacts, us having to stay home, be isolated, not to spread the disease. So the preparation there is a little more difficult to practice. And of course, the big issue of criticism was we didn't have a stockpile of personal protective equipment. But that's a $25 to $50 million requirement and a shelf life of 2 to 3 years. So how do you do that and have a budget that reflects the need to do that with collaboration from the legislature is something we need to take a hard look at, because the need to have it available is certainly true, but how we do it is a little bit more of a challenge. So we are going to work with our unified command. In fact, we're going to be working with the hospital groups and healthcare professionals, meeting with them actually today to talk about, you have a need for PPE. We need to have some stockpiling so we are better prepared if we have a future pandemic. How can we work together to ensure that you in the medical care have what you need, and we as a state, in anticipation of maybe a future emergency, will not be caught short-handed. Now, as we say, the audit says we were kind of caught off guard, but I would say that the whole world was really caught off guard. I mean, certainly all the states in the United States of America were caught off guard. Nobody any better prepared than we were in Utah. Not that that's an excuse, by the way, but that's just the reality that we faced ourselves as we found this pandemic taking place here in the state of Utah. We had our unified command, which we announced on March 26th. But I want to assure people when this came at the end of February and we started seeing this come across the country, starting in the state of Washington, we immediately had our Department of Health, our Department of Public Safety, our emergency management team in constant communications in anticipating what was going to happen. We were hoping for the best, but we were starting to mobilize and prepare for the worst. We had the Unified Command, which still, meets every week, usually 3 times a week, and studies the data. Hopefully next week we'll have a report on how data is compiled and the results and the outcomes and what that means and what we're doing to make sure we have good data to inform us so we can develop good policy, which gives us, in fact, the appropriate outcomes. We'll have a little discussion on that in this next week. Anyway, it's been a unique situation for us with a pandemic, which is not like really any other emergency, which are generally just a localized event that takes place over a short period of time. I would say the old adage that practice makes perfect. Certainly we have parts of the world that have had epidemics, and part of their culture, like wearing a mask, is a little bit easier for them to do because they've been doing it for so long. Not so much here in America, but our culture probably is going to change a bit because of this pandemic as we work through it. I think we as a state, thanks to the audit and changes and corrections have been made or being made, will be better prepared for emergencies like this in the future. And I believe we as individuals are going to be better prepared. We started when I was Lieutenant Governor what we call the Be Ready Utah program. And that really spawned out of flooding. I went to see the folks in New Orleans and Louisiana after Hurricane Katrina. I remember that big event there. And what we learned there was that people weren't prepared. And so we came back with our Be Ready Utah program to help us prepare for whatever, fill in the blank, fire, floods, earthquakes, economic downturn, etc. We also advise people to have 72-hour kits. In the 72-hour kits, you're going to have, your medicines, your necessary supplies to survive for 72 hours, food, water. But I expect that now, as we've learned, in your 72-hour kit, you ought to have some masks, which will help you as you go out and interface with the public during a pandemic. So an added necessity to our 72-hour kits is something we as individuals and families have learned through this process too. So we are going to get better. We're learning as we go, and we're going to be a lot better in the future. Again, let me just say in conclusion, again, I'm grateful for the good work of so many people. Again, we've done as well, if not better, than most any other state in America. It doesn't mean it's been perfect. It doesn't mean we don't have room to improve. We do, and we are. We already are practicing, for example, stockpiling. I saw a picture on the front page of the Deseret News today that showed all the PPEs that we've now stockpiled in our warehouse. So some of the criticism and the recommendations that have been given in the audit that just came out yesterday, we're already doing as part of our practice today. So again, we'll continue to work with the healthcare professionals, our healthcare hospital association, to make sure we're doing what they want to do. Let me just mention again as an example, it keeps coming up, and that's the contract we had on hydroxychloroquine. Again, as we go back and look at the time, we had a lot of people, some in the legislature, some outside our state, people in Washington, D.C., talking about the benefits of hydroxychloroquine, a multiple use and off-label use, to be sure, for COVID-19, but that the benefits of it. Then we had a reversal, and we had many in the medical arena say, no, it doesn't work. We still get mixed messages even today. We had a contract for $800,000. We got every penny of that refunded to us as we determined, our Unified Command, that was not a wise purchase at the time. But even the audit indicates, we did probably what was right to do at the time and got a decent price on the product. But even today, I just met here recently with Steve Hahn, who's a medical doctor, and he's over our FDA. I asked him, what is your thoughts about hydroxychloroquine? He said, well, as a doctor, I think it works in the early stages of the coronavirus as a therapeutic medicine. After that, I wouldn't use it. I would never use it on somebody that goes to the hospital. So even today, we get mixed messages on the use of this medicine. So appreciate, again, the uncertainty and the confusion that's out there that we're having to in fact, engage upon. And I appreciate the good work of people in our Department of Health, our Office of Management Budget, to work with the legislature, the private sector, all stepping up, trying to navigate through this really uncertain world that we've had with this pandemic that only happens about once every 100 years. We hope we don't have one, but we're going to be better prepared if we have one 100 years from now, I can tell you. Okay. Well, with that, let me just say we appreciate those on the front lines in the medical profession. Nurses and doctors doing great work at our hospitals, our clinics, making sure that we have opportunities if we get sick to be treated. It's been hard on them. They are constantly on call. I'm sure their fatigue is setting in because of the workload that's required because of this pandemic. It's impacted us all. We're all probably tired of this and wish it would go away. Hopefully with the vaccine, things will get better soon. And until that happens, we have to continue to keep our best efforts going forward, our best thinking, make sure that we have the best available treatment for those who get sick, and then protect ourselves. It's the old Benjamin Franklin, an ounce of prevention is worth a pound of cure. So wearing the mask, for example, is an important aspect of what we think is prevention. The things of washing your hands, of social distancing, not going to work when you're sick. The common sense things are going to help us prevent the spread of hydroxychloroquine. And in the middle of all this, we have some surges taking place in Utah County. We've talked about that here last week, having to put more restrictions on the Provo-Orem area. We have the great opportunity to hear from Dr. Clark Bishop, who's a critical care and pulmonary medicine physician from Intermountain Healthcare's Utah Valley Hospital in Provo. And he's on the front lines. He treats people in the ICUs. He's seen it up close and personal. He loves his job, and he wants to make sure that we don't have to come and see him. So we're going to ask Dr. Bishop to share a bit about his experiences with treating COVID-19. So Dr. Clark Bishop.
Good morning, and thank you to Governor Herbert for extending this invitation. As Governor Herbert said, I am a frontline physician. I've practiced pulmonary and critical care medicine at Utah Valley Hospital since 1985, and I do love my job. I would wish every one of you could come and see the great things that we do. Governor Herbert talked about the team of people that we have. He mentioned doctors and nurses, and the team is more extensive. We have amazing aides that help us, our patient care technicians, pharmacists, even the housekeepers and the hospital administrators. This has been a terribly stressful time for hospital administrators. Governor Herbert mentioned that I'm from Utah County. I grew up actually in the same area, went to the same schools as his wife and their family, and have just a great love for Utah County. That's my home, and I'm deeply saddened at what's happening there because of the controversies around this disease. It's become contentious, and it doesn't need to be contentious. There's some things that we do know. As Governor Herbert said, you know, we've had mixed messages about the wearing of masks. And so I think it has been somewhat confusing, but there certainly is emerging science that tells us that masks help prevent disease. And I just want to make 2 points today. One point is masks make a difference. And let me just maybe share with you a little bit of some of the evidence behind that. The evidence includes things like when we started having this COVID-19 infect people in Utah, one of the hot spots was Summit County. They had far, far more people per capita than most of the other places in the state. There were people coming in and out of the county because of the skiing and so on, and so that was one of the places where it started. But they had a mask mandate A lot of people didn't like a mask mandate. They didn't like to be told what to do. But it set the expectation. The expectation was we wear masks, and when we do that, it helps to prevent the spread of COVID-19. And very soon, Summit County kind of dropped off of being a hot spot, a trouble area. Now we have a hot spot trouble area in Utah County, my home. And we need to do the same thing. We need to wear these masks to help us prevent that. I would suggest, as Governor Herbert said, that if we want to win, then we can think of the three things that will help us to win. One of them is wear the mask. The second thing is wash your hands frequently. And the third thing is watch your distance. Stay socially distanced. If we do those three things, then that will help us a lot. There are a couple of other little, I think they're kind of case studies that help us to know how important wearing a mask will be. One of them was a documented case in Missouri where there were two hairdressers who both were infected with COVID-19. They didn't know it at the time, but they were still cutting hair. They wore masks, and they also required their patrons to wear masks. They had, I think if I remember correctly, around 140 patrons between the two of them come in and out of their salon. Not a single person developed COVID-19. Even though two people had the COVID-19, that was very, very effective in preventing the spread of COVID from the people that were infected to their patrons. On the other hand, there was a situation where there was a woman who was on an airplane. She was sick. She didn't know she had COVID-19, but she had symptoms. She was coughing. She was on a plane, and at the end of that, the people around her, and I think they traced 27 different people from this one super spreader. She wasn't wearing a mask. The other people weren't wearing a mask, and because of that, 27 people got sick that really wouldn't have needed to get sick if they had been wearing masks. And there's another situation kind of similar, but the opposite. It was a man who was on an airplane. He was sick, didn't know he had COVID. He was wearing a mask. The people on the plane around him were not necessarily wearing masks, but nobody on the plane got COVID-19 from him because he had the courtesy, because he had the decency to wear a mask and prevent that. So those are just a few little anecdotal kinds of evidence, but there's the basic science is sound, and so I would plead with you to wear a mask, and especially students in Utah County. When you're going to be with your friends, please just wear a mask. Set that as an expectation. Hey, around here we're gonna mask up. That's what we do. That's the way that we can do that, so that we can stay open, so that we can stay with our friends, so that we can go to businesses, so that we can do the things that we need to do, so that we can go to school. All of those things can stay open if we'll wear a mask. My concern is that if we don't wear masks and we continue to have this surge, then we'll have to shut down our businesses, our schools. And I'm also really concerned about what I'm going to see in the ICU where I practice, that I'll see a surge of patients that will overwhelm us. We have done very, very well by any standard in terms of our mortality and our survival from COVID-19 in our Utah hospitals. We have had the resources. We have planning. We have amazing teams of people, but we can be overwhelmed. So the first point is please wear a mask. The second point I'd like to make is, well, does it make a difference? If only less than 1% of people in Utah die, why don't we just have rave parties and all get together, and who gets sick, and most people won't die, and then we get over it. And my plea is, please don't do that. The people who get sick with COVID are very, very sick, and each one that I see, it's heartbreaking. And I wish you could see what it's like to have somebody who's got COVID and is not sure that they're going to survive. They're in the ICU, all alone, no visitors nowadays, writing goodbye notes to their children. That's not something that's easy to watch. I wish you could see the fear in families' eyes when they see somebody transferred to the intensive care unit, afraid that they're going to die. I wish you could hear the friends of people saying, I pray morning, noon, and night, and in between, for my friend who's in the ICU. Well, that particular friend right now is out of the ICU. Should we cheer? He's improving. He's off the ventilator now, but we're not time to celebrate quite yet. COVID can be very, very cruel. Sometimes just when you think they're better, their lungs are starting to improve, then their heart stops from myocarditis, and they're gone. This particular gentleman that I'm thinking of, he's off the ventilator, he's out of the intensive care unit, but he can't walk from here to a bathroom 10 feet away without his oxygen saturations plummeting. There's still a horrible fibrosis in his lungs that's not getting better. We have some people that we call long haulers. The long haulers are people who have been affected by the COVID-19, and it just keeps hanging on, and it doesn't go away, and they don't feel very good. They cough, they're short of breath, they have fatigue, sometimes they have mental fogginess. This is a miserable, persistent, ugly disease. And whatever we can do to prevent it, we ought to do. Utahns have a history of being generous, of wanting to get involved, of wanting to serve, of stepping up when there's a problem. I've wanted to, we say, what can I do? How can I help? Well, there are three things we can do that we can all do. There are small things, there are simple things. Some people may think they're foolish things, but they're not foolish things. They're small and simple things that will make a difference, that are the best science we have, and it's not perfect science, but the best science we have says, wear a mask, wash your hands, watch your distance. And if we do those things, then we can help to bring this thing to a close, and we can win this thing. Governor Herbert said, an ounce of prevention is better than a pound of cure. We're working on the cure. We're lots better than we were 6 months ago. We've learned some things that work. We've learned some things that don't work. And so we are better. But it's still way, way better to be able to prevent COVID than to try and treat COVID. So I just leave those things with you, and I hope that you'll be able to tell your friends and create the expectation in our home when we go out, in my apartment with my friends, we wear masks. That's just what we do. We do that because we are socially responsible, because we're considerate, not because we're living in fear, but it's because we want to have our lives as normal as possible. And this is a small, simple thing. So I just plead with you to be not weary in well-doing. Do those little things that we know make a difference. And I'll be happy to answer questions after Governor Herbert. Governor Herbert, I'm sure there's nothing controversial going on, so there may be some questions for me today.
Well, thank you, Dr. Bishop. It's nice to know you still have your sense of humor. So we appreciate good work of you and so many others like you throughout the state. I know the surge is causing concerns in Utah County, Utah Valley, with increased hospital utilization. And, masks are like seat belts. They only work if you use them. So whether it's a mandated requirement or just because it's good sense, most of us wear a seatbelt, not because it's the law, but because we know it will reduce our risk for injury if we're in fact in an accident or injury and death. So we do it because it's the right thing to do, because it works. So we hope that people will follow the counsel of this great doctor here make sure that we in fact wear a mask, socially distance, and wash our hands. And again, I'd add stay home if you're sick. And to that end, there's a corollary here I'll just mention before we open up for questions. One, we have seen some significant reduction in our minority populations, our Hispanic and Latino populations. Their infections, which were at the highest end of our populations in the beginning, have been cut now down in half. And so we appreciate the fact that the percentage of cases among Hispanic and Latino populations continues to fall. That's good news for them, good news for all of us. Our mortality rates are still low, or less than 0.7%, so that's some good news out there. And our stay in hospitals is shortened, so some lesser times there, and that's thanks to the good work of our medical experts and learning how to better treat those who, in fact, contract the COVID-19. Now, in some economic news, we announced here we have a variety of jobs that are available throughout the state. And so our Workforce Services Department are there to help people who find themselves out of work or maybe going to be out of work. And we'd encourage them not to wait. If it looks like you're going to come to the end of your opportunity to work in your current job, or you're not going to be hired back, then please contact our Workforce Services people. We have this UT Job Support Campaign, which is going to help you find a job. We have a lot of jobs out there that are going wanting right now. It may necessitate some retraining, some new education, some new skill sets to help you qualify for the job, but there are job opportunities available right now. So go to jobs.utah.gov, jobs.utah.gov, and you'll find some help and some opportunities there to, in fact, get employment if you're facing unemployment. Also along that, we're announcing today that the Utah Labor Commission has a $2 million grant that's going to help small businesses defined as those who have less than 50 employees, which will allow businesses to continue to pay employees even though they're not coming to work. They're sick. They're not coming to work, is what we've advised them to do. They're sometimes afraid if they don't show up to work, even though they're sick, that they'll lose their job or they're going to lose their income. So this, in fact, grant is designed to help with small business employers to pay that employee even though they're not going to show up to work for a couple of weeks, 40-hour weeks, and so they'll get paid, and that would alleviate the pressure that some would feel to have to show up to work while you're sick. So that's $2 million grant. If you want to learn more about that, you can go to coronavirus.utah.gov/business. That's again coronavirus.utah.gov/business, or you can go to the Labor Commission's own webpage at laborcommission.utah.gov, laborcommission.utah.gov, to get additional information on that. So it's a challenging time, still uncertainties out there. We're making headway. I'm very optimistic about the future. We need to pull together, and I think we do that. We're going to come out triumphant on this effort over the next few months. So with that, we'll take some time for some questions.
Yes, hi, this is Wendy from Deseret News. Governor, you said these are not just numbers, but are people. What does it mean to you to have, or to say that at least 74,000 of us have been impacted like this?
Well, if I could wave the magic wand, there's a lot of things I would do away with. Car accidents, for one, any kind of cancer. There's a lot of diseases out there that take people's lives, makes their lives where they become invalid. We have accidents that occur all the time. People become disabled if they don't die. I mean, there's a lot of things that impact us in this mortal existence which are detrimental to our lives and cause us to mourn for our fellow man. The pandemic is just a new disease. It's a novel coronavirus, meaning it's a new disease. We haven't had it before. We've had other coronaviruses. This is unique. It's COVID-19. I wish we didn't have it. I wish we had a cure to eliminate it today. But until we get to that point, we need to understand that it's going to impact people in our population, and we need to have compassion for those who are infected with it. We need to do all we can to prevent it from spreading. We have a responsibility as people. Government has a role to play, but at the end of the day, I just mentioned the seatbelt law. It doesn't matter if we have a law if you don't wear the seatbelt. It doesn't matter if we have a mask mandate if you don't wear the mask. It doesn't matter if you refuse to abide by physical distancing requirements, which is probably the best way to avoid having catch the coronavirus. That's why we're doing better in rural parts of Utah where we have very sparse density. So we all have a role to play. We ought to have compassion for those who have it, do our best to make sure we do slow it down, stop it. And again, I'm optimistic that we'll have a vaccine in a few months, which is going to be really the beginning of the end of this. Until that time, we do the best we can and treat each other with respect and kindness and concern and do what we can to help. Next question.
Yes, Governor, or Dr. Bishop, this is Paul Nelson with KSL News Radio. Dr. Bishop, you mentioned that you are worried that the ICUs can get overwhelmed. So my question is, how close are they to being overwhelmed? What are our hospitalization rates now, and what are the projections looking like for the near future?
I don't know the best answer for that. What I can tell you is we have, right now we have capacity, but we're busy. I was on call last night in the ICU, and we were able to treat everybody that we needed to last night, but we also had to do some shuffling within Intermountain Healthcare. We have a policy within Intermountain Healthcare that's called One Intermountain, which means that we can move somebody from one facility to another facility when somebody has capacity and somebody doesn't have capacity. And so right now we're at that. So, I don't know what the projections are right now. I know that those have changed over time. But I know that we're really, really busy right now, and we're working hard with contingencies. We still have beds. We still have ventilators. We have plans and backup plans of the backup plans. But it certainly is possible for us to be overwhelmed, and we don't want that to happen.
Let me just add to, again, part of what our Office of Management Budget does, and again, I mentioned we'll have a little bit of report on this because I think people are probably curious about how we gather the numbers and what do the numbers mean. How do we assemble them and try to determine what the trends are, what it means, and what the policy should be, in fact, based on the data. But the data would show us with hospitalization utilization of our rooms, we have capacity. We're at about 65% capacity of overall of our hospital bed units in the state, which means we still have pretty good headroom on all hospital rooms. Our ICU utilization is a little higher than that. Percentage-wise, we have fewer ICU beds. Obviously, there's about 550 to 600 ICU beds, and we're using probably about 65% of those. About 14% of those are COVID-19 patients. Not a large number, but a significant impact on ICU use. We were down to around 6 and 7% at the low end. Now we've doubled that as we've had this spike that's taken place. And so that presents concern. It's not just the bed space itself, but as Dr. Bishop was talked about, it's about people to man or woman the ICU bed. And they've got to have trained personnel there. And that's probably the biggest concern, I think, in the healthcare system right now is the personnel as opposed to the beds. So it works in conjunction. That's why we're in constant communication with our healthcare professionals, our different hospitals and hospital association to make sure we're doing everything we can to work in concert, as Dr. Bishop said, working together as one. Next question.
Hi, Governor Herbert. Dr. Bishop mentioned that he's concerned that if people in Utah County don't wear masks, then they may need to shut down businesses, shut down schools. We're seeing, still very high new case numbers, very high percent positivity rate across the state. Are there any metrics that you're looking at to consider implementing any additional restrictions? And if so, do you know what those restrictions might be?
Well, as you know, last week, because of the spike that took place, the epicenter of it being at Brigham Young University and Utah Valley University, the Orem Provo area, we in fact increased restrictions there. We have a color-coded method to do that, but they went from the yellow color code, which is moderate, low restrictions, to a more moderate restrictions into orange. That has the impact of, in fact, impacting the economy more than anything else. What I do appreciate was that the Utah County Commission, at least two of them, have stepped up along with the Utah County Health Department, which is where this order really is coming from, which is what their job is under statute, and said we're going to have a countywide a countywide mask mandate to help us slow this surge, to stop it. And the good news is, at least the data has shown us the last 4 days, it really is kind of stabilized. It's not increasing in Utah County like it once was before. And so that's good news. The mask mandate maybe is working. Maybe more education. People are now taking it a little more serious. More awareness of what their own individual responsibility is. There's probably a variety of reasons, but I hope that trend continues. If that continues, then we'll be able to take a look here shortly to move from orange back into yellow and lighten up the restrictions. We'll have to watch it and see. Again, I think the mask mandate has helped us not have to feel compelled to move the rest of the county from yellow to orange. That would certainly have an impact on businesses and a negative impact on the economy, which, again, as you all know, we've been trying to find the appropriate balance of health care and health of people's individuals, as well as their livelihood and health of the economy. And we've struck a pretty good balance. We're going to continue to do that.
Yes, good morning, Governor. Brian Malahi, how are you?
Good, thank you.
Good, good. I wanted to turn to the audit for a moment, and the auditor noted that millions of dollars were spent in state contracts for Silicon Slopes companies to address coronavirus concerns through their various services, and yet the auditor also concluded that many high-level state officials involved in those discussions failed to understand the evolving nature, believing that those services were going to be donated when they were, in fact, paid millions of dollars. These companies were paid millions. So my question is, a couple of questions actually. One, did you believe that these services were going to be donated or provided at no cost? And number two, were you misled by the companies, and was your trust ultimately in them misplaced?
Let me answer it this way. I was encouraged and appreciative of the fact we had people in the private sector say, we have something to offer, and tried to step up and find a solution to a very difficult and complex problem. They were probably overly ambitious in trying to do that, not realizing, like many of us, including those in the medical profession, how complex this is and how it's going to permeate so much of our society. So I appreciate the fact that their heart was in the right place, and as I understand it, this was a place at a different level than where I'm at. This is done by our staff people and our people in the health department, and we certainly had involvement with the data people, which is our Office of Management and Budget. That's where we had some communication gaps, it looks like to me. I mentioned that early on here months ago, and the audit has borne that out. And whether the right hand knew what the left hand was doing, I think that was probably part of the concern we had. And again, in an effort to rapidly get things done, we knew that PPEs, for example, were in short supplied worldwide. The folks that we worked with, in fact, part of the Silicon Slopes was designed to help us, in fact, bring in PPE from outside of our country, because they had resources that were outside of the United States and from foreign lands that helped us bring in plane loads of supplies for PPE, and it was getting in short supply. So they helped in a significant way in that regard. The idea that was to be done without pay and donated, I think, was a good idea in the beginning, but it appears that as we got into reality going down the road, we found that was not going to work. And so we had bid contracts were put in place. Again, not having the opportunity to go through a traditional RFP. If we'd have done that, we would not, in fact, got PPEs. We wouldn't have had some of the resources we needed. The testing was done too, again, which has been an issue not without controversy. But if you go to Iowa, if you go to Nebraska, I've talked to the Nebraska governor, they just heap praise on Utah and our folks that are providing with them. We have a test Utah, they have a test Nebraska, which they're doing significant numbers of testing in Nebraska, and they're very pleased with the results. So again, there's always room for improvement, probably room for constructive criticism, and we've learned as we've gone, and we'll do better the next time. We hope there's not a next time, but we'll be better prepared because we've had this experience. So I feel good about the effort. I understand some of the gaps that were there and the concerns. But again, all these contracts, all these issues are available for people to look at. They've been on a webpage for weeks and months to take a look at.
If I may, Governor, did you though, however, and the question relates to this, did you believe that the companies were providing these services at no cost or donating them? And if so, were you misled by the company?
I never knew, I was never told that there was going to be donated. I always believed that there was going to be a payment required for services rendered. And so,
at no cost?
Well, no, a payment.
Or at cost, excuse me, to the companies?
Well, whether it was going to be at cost or there was some margin of profit in there, I just knew we were going to be paying. I've always believed we were going to be paying for the services. I've always expected that they were going to make some margin, certainly revenue over expenses and some margin, whether it was a discounted amount of profit. I think we found with the audit that there was not really, we didn't get gouged on anything. So I think the intent and the good faith effort was there, but I've always thought we were paying for the products. Next question, this will be the last one.
Hi, Governor. It's Ben Winslow from Fox 13. I just wanted to know on this audit, and given that there has been some criticism leveled by the state auditor over how much money the state paid versus what they got, particularly when it comes to testing, did taxpayers get their money's worth, do you believe?
I think they got their money's worth. We had a contract, as it turned out, did not work as well because we didn't have people going in to get testing. So we had the capacity to test 4,000 or 5,000 people. We tried to get up to 6,000. We eventually got there, but the contract we had in place was just for as many that came in. If we had 4,000 or 5,000, it was going to cost us $44 a test. If we had fewer people come in, then it proportionally rose up in cost per test. It didn't cost us any more money. It's just the average cost per test because people were not availing themselves of getting a test went up. So I think we got our bang for the buck. Again, we've learned, and again, as we go forward, that's RFP is still out there pending as far as testing and seeing what we can do. We've had some unique situations with the labs that were involved here that have had some challenges with their certification. Had nothing to do with the people supplying the tests, but still added to the confusion. So again, one thing that's certainly easy to do is to look backwards and say we could have done better, and here's areas of deficiency. I acknowledge that, and in hindsight, there's a lot of things we could have done better. But in the fog of war, in the situation we found ourselves where there was just so many mixed messages out there from the medical people, from just every, we still have criticism that we've opened up too fast. We have criticism we have too much restriction. I mean, you know, we're still getting criticized. There's no end to people willing to criticize, but we've put forth, I think, a very good effort to find appropriate balance, as we've said in the very beginning, following the plan that was developed by very bright people that we tried to follow. We've made some adjustments and modifications as we've learned more, which has put us in a pretty good spot today where we have low fatality rates. Our medical people are shortening the time that we're in hospitals, and our economy is doing quite well in comparison. It doesn't mean it's perfect, doesn't mean we have room for improvement. We do. And this audit's going to help us learn where we had deficiencies and improve as we go forward. So I'm grateful for the audit. I'm grateful for the learning process we have here under a very difficult and uncertain circumstance. With that, again, we'll conclude today. Again, we'll have more information next week. talking about numbers and what they mean and how we collect them and collate them and how that develops into policy. I think that's something that the people of Utah would like to know a little bit more about. But we do appreciate everybody's efforts. This is not anybody having the sole responsibility. It's about all 3.2 million people of Utah doing the best they can to be a part of the solution. Some of us out there are part of the problem, and we ought to take a reflective look at ourselves and say, what can I do to make things better and make sure that I'm not part of the problem, but I'm part of the solution. If we do that, working together, we have a very bright future and a bright outcome around the corner. So thank you very much. Good luck and God bless.
I just wanted to add one note for Sophia's question. If you referred to last week's briefing with Rich Saunders, the director of the health department, he did go through those restrictions and what that would take for counties to move from one color status to another. So we'll conclude today's briefing. We thank Governor Herbert and Dr. Bishop, and as always, we're grateful for our interpreters in ASL and Spanish. Thank you.